know how much bacteria we possess as individuals, but have you ever wondered how much bacteria is possessed between two individuals? There are many changes in the microbiome that occur between both the mother and the baby during pregnancy.
As women who would like to have families one day, we were very curious about how our bodies would change during pregnancy.
Outside of the naked eye.
Since the three of us are going into healthcare fields, we wanted a better understanding of the microbial changes that would occur. During the beginning of our research, we discovered that there were so many different topics that could be discussed referring to the microbiome during pregnancy. We decided to narrow it down to what we thought were the three most important.
The fetal microbiome,
The maternal microbiome,
And complications that can occur during the changes in the microbiome.
When conducting my research, I decided to divide it into the different trimesters and see what the microbiome looked like or changed during the different trimesters, and also what it looked like during and after birth. And I also decided to just research the general bacteria of the microbiome of the fetus because it is a new body occurring in the mother.
For my part of the project, I chose to talk about three different parts of the maternal body: the gut microbiome, the vaginal microbiome, and the oral microbiome.
I decided to research the complications that these microbial changes can cause, one of these being preeclampsia, and other possible negative effects towards the mother and the baby.
Now, enough of the small talk.
Let's get into it. The first change that I'm going to be talking about that happens in the maternal microbiome are the changes in the gut. One of the most significant changes is the increased inflammatory state, which can be a good thing and a bad thing. Pregnancy leads to a 70% increase in inflammatory states, which is essential for supporting the developing fetus and preparing the body for labor. However, it can lead to risks in the maternal body, such as gestational diabetes and preeclampsia. There are two significant species in the gut that play a crucial role in regulating metabolism, immune function, and boosting overall health. Those are the Bacteroides, which are typically linked to a healthier metabolic function and balanced weight, and the Firmicutes, which are associated with higher energy extraction from food. During pregnancy, the ratio of Bacteroides decreases and the ratio of Firmicutes increases, which actually mimics the gut of someone who is obese. However, it is essential to ensure that the mother has enough energy reserves throughout the pregnancy and for breastfeeding after birth. I'm sure everyone knows that the body undergoes hormonal changes during pregnancy, but these hormones, such as progesterone and estrogen, can influence the motility and the contractility of the gut, which can alter digestion and nutrient absorption. All of these metabolic changes ensure that the developing fetus has all the nutrients it needs to be able to grow and develop. Next, I will be talking about changes in the vaginal microbiome, which mostly talks about increase and decrease of different bacterial species. The first bacteria, Lactobacillus, is dominant in a non-pregnant vaginal microbiome, and it is considered good bacteria because it helps regulate the acidic pH. The numbers of Lactobacillus decrease during pregnancy because the hormones that we talked about earlier take over and make the vagina more suitable for other bacteria to grow, and it favors that growth more than the Lactobacillus. So even though Lactobacillus is still there, the numbers are significantly decreased. On the other hand, there is two bacteria that increase in the microbiome, which are Streptococcus aeruginosa, which is mostly just normal flora, so it can be fine for the microbiome. However, if the numbers of this bacteria get too big, then it can lead to infection. And then the other bacteria is Prevotella bivia, which is harmful in big numbers because it can lead to an imbalance in the vaginal microbiome and then lead to pregnancy complications such as preterm labor. During birth, the vaginal environment is exposed to a lot more bacteria from the hospital, and although this is not necessarily a bad thing, it can make the vaginal environment more susceptible to infection and overgrowth of bacteria. With all of these changes taking place, it is likely that the vaginal environment could become imbalanced, but things like maintaining a good hygiene, avoiding harsh soaps, and consuming a balanced diet can help to restore the microbiome, and actually breastfeeding can help promote a healthy microbiome as well in both the mother and the baby. And if all else fails, you can always use medical interventions such as antibiotics to help with the restoration of the healthy microbiome. Finally, I'm going to be talking about changes to the maternal oral microbiome during pregnancy. During pregnancy, there's an increase in bacteria in the mouth, such as Lactobacillus, different streptos species, and even E. coli, so if that's not treated, it can lead to oral infections. Due to the increased level of progesterone, pregnant women are more susceptible for gingivitis, which is an early-stage gum disease, and if left untreated can lead to periodontitis, which is a more severe gum disease that affects the bones supporting the teeth and can lead to pregnancy complications such as preterm labor and low birth weight babies. And due to morning sickness, your teeth can actually start eroding from the pH changes from the vomit in your mouth. This is why oral care during pregnancy is critical and can include brushing and flossing regularly, dental checkups, hydration, a healthy diet, and managing symptoms of morning sickness. As you can tell, there are significant changes that take place in the maternal gut, vaginal, and oral microbiome during pregnancy. Being aware of these things and knowing what to look for is essential in ensuring a healthier pregnancy for both mom and baby.
Okay, so I researched the fetal microbiome and what it looked like during pregnancy, and when I was beginning my research, I was finding it very hard to find information on what the fetal microbiome looked like, and that is because there's not a lot of information on what the fetal microbiome looks like. For years, scientists have concluded that the fetal microbiome does not exist because it is inside of the mother's womb, and it is considered a sterile environment, so they haven't technically come in contact with any bacteria until birth occurs, so there's no microbiome there for them to actually have researched on until the past few years. There were a lot of issues trying to research this because there was no way to get the bacteria from the fetal microbiome without hurting the baby or causing infection or getting cross-contamination with tools being used from the outside world going into the mother. So it's taken scientists a while to figure out a way to research this. There was a study that was successfully conducted in Australia, and they conducted it on about 32 women at 32 weeks pregnant. They were able to find a way through a needle to extract amniotic samples from the mother and test those for different bacteria. They were able to discover different types of bacteria that did occur in the amniotic fluid. A few of those being Palomonas paragoi, Streptococcus spp, and S. epidermis. With this initial research conducted, we were able to conclude that there is a microbiome for the fetus, but it's not been studied enough to say for sure what it looks like. However, with all of this being said, we do know enough about how babies develop in the womb to say what kind of bacteria may occur in the womb or gets transferred from the mother to the baby through amniotic fluid. Some of the bacteria that occur in the mother and are transferred to the baby or are in the womb when the baby's in the womb are firmicutes, tenoricutes, proteobacteria, bacteroidetes, fusobacteria, and other important metabolites such as SCFAs, otherwise known as short-chain fatty acids. Again, with little knowledge on the fetal microbiome, it was hard to find exactly what happens in each of the trimesters, but I was able to figure out what types of bacteria are present in the mother that carry on to the fetus during the different trimesters. So during the first trimester, there's lower levels of the proteobacteria, the bifidobacteria, and the lactic acid-producing bacteria. Instead, there's higher levels of the butyrate-producing bacteria, which makes sense because the butyrate-producing bacteria creates a safe environment for those short-chain fatty acids to occur, which is essential, especially in the first trimester, because that is when the fetus is initially developing. During the second trimester, the mother's body is working on getting those protobacteria and the bifidobacteria back to a normal level to maintain homeostasis for herself, and the butyrate-producing bacteria remain the same, if not higher, for the fetus. This is because during the second trimester is when the immune system is initially developing through the fetus, and that is triggered by those short-chain fatty acids. It's important for these bacteria to be present, especially during the second trimester, because it triggers the development of the immune system and whether it's going to be sensitive to certain things, and that's when the allergies are created, or if they're not going to be sensitive, and it kind of determines how strong the baby's immune system is going to be, which also includes allergies being inherited through the mother. During the third trimester, there are lower levels of the butyrate-producing bacteria because the fetus is mostly developed, so they don't need that bacteria as much anymore because there's no need for the development to continue further through those short-chain fatty acids. Because the baby doesn't really have a microbiome inside of the mother, most of its bacteria is obtained during birth. And depending on what type of birth occurs affects how much bacteria is on the baby. Babies born vaginally are able to obtain a lot of bacteria from the mother because it's coming directly from the mother during birth through the birth canal. Compared to babies who are born through cesarean section, they don't obtain any of the vaginal flora, which can be potentially harmful for them, not only during the infant phase, but also during the toddler phase. Because they don't pick up that initial vaginal flora from the mother at birth, and it is so important, they are more prone to have allergies to the environment, to food, to many different things, even in their life as a toddler. So babies born vaginally are less prone to having a weaker immune system than those born through C-section. That is continuous from the life as a baby when you were born as an infant to a toddler to an adult, whether that's allergies or just to sickness in general and to other diseases such as asthma. And that wraps it up for the fetal microbiome.
So what are some of the negative effects and complications that can be caused during pregnancy due to changes in the microbiome? One major one is preeclampsia, which can be defined as hypertension, proteinuria, which are urinary infections, and organ dysfunction. And some of these organs can include the central nervous system and the liver. Preeclampsia affects 2 to 8% of pregnancies worldwide, and it's one of the most common causes of morbidity and mortality. Although there are limited studies on this, it is proven that the gut microbiome composition is altered during preeclampsia, and a predisposing factor is the presence of bacteria in the placenta. Preeclampsia is caused by increases or decreases of specific bacteria while you're pregnant. Some of the consequences of preeclampsia are possible predispositions to babies or mothers to later on diseases, and some of these diseases can include obesity and type 2 diabetes. So you may be wondering, how do you prevent preeclampsia? Studies have shown that the use of probiotics can reduce the risk of preeclampsia, so it's very important to be taking those while you're pregnant. Another big negative consequence to changes in the microbiome during pregnancy can be gestational diabetes mellitus, and this can be described as pancreatic beta cell dysfunction, hyperglycemia, and insulin resistance. Gestational diabetes mellitus has a 5.4 to 14% global prevalence, and studies have been shown that it is differences in the gut microbiome, whether it's an increase in certain bacteria or a decrease in other bacteria. Other negative effects of changes in the microbiome include preterm birth, gestational weight gain, fetal growth restriction, and the gut microbiome has also been proven to be associated with pregnancy loss. When researching, one thing I found really interesting is that changes in the microbiome don't only affect the mother and the baby while it's in womb, but it also causes effects throughout infant years, and it can be linked to neurodevelopment, which will affect the infant's behavior, and even allergies, which is kind of crazy thinking that allergies develop inside of the womb. One important thing to keep the microbiome in good standing is to take pre and probiotics. And that's what I have for you guys on the negative effects and consequences of the changes in the microbiome during pregnancy.
After watching our video, we hope you learned everything you wanted to know about the fetal and maternal changes during pregnancy and learned about the possible complications that can occur.
Overall, I found this research to be very interesting and very beneficial, especially as a woman wanting to have kids in the future. The most important or the most interesting takeaway that I found from this was the differences between the immune systems based on what type of birth occurs. Babies born vaginally tend to have a stronger, better working immune system compared to those born through C-section who had a weaker overall immune system, even as a toddler. It was interesting to learn, as I am a C-section baby.
Me too. Same.
Other than the obvious changes to a mother's body during pregnancy, such as weight gain and hormonal changes, I had no idea about all of the things that take place throughout the microbiome. And although some of them seem scary, I am so glad I have more knowledge on the topic.
What I found most interesting was that the microbiome during pregnancy can have effects on the baby not only in womb, but throughout toddler years. There can be many scary and dangerous consequences to these changes, and as a woman, it is very important to be aware of these and how to prevent them. If you or someone you know is pregnant, you should totally check out this video.
We appreciate your time.
Thanks for watching!